I'm going to talk about the use of cupping today to treat any kind of elbow pain. So cupping was made famous, I think, mostly by Michael Phelps during the Olympic Games when people saw his back full of red circles and wondered what was going on. So essentially we use cups to pull the tissues away from each other. So some people think that we're pulling out toxins out of the skin and things like that. I mean, we are increasing blood flow to the area, but a lot of times if we think about tissues being like layers of lasagna, and there are certain things we can do with massage and things like that where we compress things and we try to get things to move together. But essentially cupping, when we get that suction, it's almost like we're taking those layers and just giving them a little room to breathe. It helps the fluids to kind of flow a little bit better, and it actually helps take the fascia and muscle and put it in a different level, which a lot of times can help things relax. So if you've been doing a lot of massage and things like that to the tissues kind of around your elbow, maybe it's not really affecting you the way you think it should. Maybe you need to try something a little bit different. Instead of being compressive, you need to be more decompressive. So in terms of the cupping, so I have here just a silicone cup, and you can get a set of these on the internet for probably under $15 at this point. So I use the bigger one here to address a lot of the inner part of my elbow. I'm gonna take a little bit of lubricant, and this can be coconut oil. Make sure that's nice and greasy where I wanna do my treatment. So I'm gonna take that cup, put it right on the area. I lift out the edge, push down, and it creates suction right there. I'm gonna start up right next to my elbow, and at first I'm going to just glide this all the way down, and I would say it's mildly uncomfortable. It's not painful, but it doesn't feel great to me. The nice thing about this as well is you can kind of gauge how much suction you have by how hard you kind of depress the bulb at the top. So if you don't like a whole lot, just a little bit of press as you're going through. If you don't mind a whole lot of suction, really push this thing down as you put it on. So at first I'm gonna slowly slide through those tissues. And you might find that in certain spots, it becomes a little sticky. Well, that's an area that I definitely wanna work on. So if that's a little bit sticky, I may hang out there, or I may start to do a little movement with that cup in place to try to free up that tissue as well. So I may do this for about 2 minutes or so, or as much as I can take. The other part I can do if I find a sticky part is I can keep that there, and I can actually just, I don't know if you can appreciate that on camera, or I can actually just move my skin just by moving the cup. So it actually takes a hold of that skin and helps me move all those layers underneath the cup here. So hopefully that'll help you to throw well.